In this video, we will discuss about some practicals which are conducted in general pharmacology. So, practicals we will discuss in general pharmacology. So, two major practicals are done in general pharmacology. One is information given on drug label, and second on drug advertisement. So first practical is, in the practical, the students are given some strip of the drug and they ask what is information written on that, what is the meaning of that. In second practical, drug advertisement, they will give some pamphlet of some drug advertisement, promotional drug literature, and you need to tell which is good thing in that, which is bad thing in that, which should be present, which should not be present. So we'll discuss these one by one, starting from drug label. So what information should be present on drug label? What information will we want? Obviously, there should be name of the drug. The most important is the name of the drug should be present. And the name of the drug may be of three types. The name of the drug may be generic name. It may be brand name. Or it may be chemical name. We'll write an example. You can easily find out what are the meaning of these. Like aspirin है, ecosprin है, and acetyl salicylic acid here. So you can easily find out. Generic name means what is the actual name of that drug. What is that drug? So whatever drugs we study in pharmacology, they are all generic name. Aspirin, morphine, atropine, all these are generic names. Then brand name is name of that drug which is given by that company. So it is identifying that brand. Like one generic drug may have several names, brand names, like aspirin can come as ecosprin, it can come as a disprin, it can come as any brand name. Then chemical name is the full chemical structure, acetyl salicylic acid. The question is, which name must be present on the drug label? Obviously, generic name. Generic name must be present. Then second, apart from name, some abbreviations are written. Like sometime it is written aspirin, IP. So what is this abbreviation? What is the meaning? The important abbreviations which are present, they may be IP, BP, USP or BNF. IP stand for Indian Pharmacopoeia. Indian Pharmacopoeia. BP stand for British Pharmacopoeia. USP stand for United States Pharmacopoeia, and BNF stand for British National Formulary. The first question is, what are the meanings of these pharmacopoeias and formularies? These pharmacopoeias or formularies are nothing but books. These are big books, 400, 4,000, 5,000 pages books. And these books contains all the details about that drug. Like in pharmacopoeia, not only pharmacology related information, like what aspirin do, what is the mechanism, everything is written. Apart from that, it also contains information like where to store, how you can test that this is aspirin, what are the chemical reactions, from where it is synthesized. So all the detail about that drug is present. So when we are writing abbreviation like IP, it states that details about this aspirin you can study from Indian Pharmacopoeia. Clear? Then some drugs, they should be given only on production of prescription, whereas some drugs can be given without prescription also. So two type of drugs are there. One are written as OTC. OTC means over the counter. So these are the drugs which do not require prescription. So pharmacist, we go to pharmacist, they can give this drug without any prescription. Whereas the drugs which require prescription, they are called as Schedule H drugs. Schedule H drugs are the drugs which should be given only on presentation of a prescription of a registered medical practitioner. They should not be given without prescription. So one of these two is written on the drug label. Now another important thing is, to a pharmacist, so many people come to take the drugs. So there is a large crowd of people. So if the pharmacist keep on studying again and again that Schedule H is written or not written, it will consume a lot of time. So what the pharmaceutical companies do is, apart from writing the Schedule H drug, warning is written that it should be given only on production of prescription. Apart from that, what they do, on the drug strip, a red line is drawn for Schedule H drug. So the pharmacist can simply see red line is present, so they will ask for prescription. So Schedule H drugs or this red line, it tells that we require prescription to get that drug. Clear? The next important thing is manufacturing and expiry date. Like it is written, manufacturing date is June 19. Expiry date is May 20. So what does this mean? First of all, what is the meaning of manufacturing date of June 19 and expiry date of May 20? So if we say May 20 is the expiry date, what does that mean? Till what date this drug can be used safely? Can this drug be used safely till 20th May? Or it is May 2020? Yes, the answer is 2020. 20 does not mean date, it means year. So it can be used till May 2020. Next question is which May? Whether it is 1st May, 15th May, 20th May, what May? Yeah? So it is till the last date. So that means it can be used till 31st May 2020. Yeah? Now second question, what is the meaning of expiry date? If we use this drug after 2020, 31st May, that means if we use it in June 2020 or is in 2021, what will happen? Will the drug become toxic or the drug become ineffective or both? Very good. The answer is none of these. If the drug do not become toxic, do not become ineffective, then what is the meaning of expiry? So expiry date is the time till which we are giving the guarantee. Pharmaceutical company is giving the guarantee that the drug will behave similar to as is written in pharmacopoeia. So after that date, this guarantee finishes. So the drug may keep on behaving similarly, but we are not sure now. Yeah? So expiry date does not mean the drug will become ineffective or toxic. It simply says that it will behave similar as it is written in pharmacopoeia if stored properly. Yeah? Then lastly, there is a term called as shelf life. Shelf life is the time from manufacturing date to expiry date. Or in simple language, we can say till what time the drug can be kept on the shelf of the pharmacist. Like in this example, if the drug is manufactured on 1st June 2019 and we can use till 31st May 2020, that means shelf life is 1 year. Okay? So that is about the manufacturing and expiry date. Now last thing written on the drug label is storage temperature. How to store the drug. So three type of things are written on the drug label. One is keep frozen. Second is keep cold. And third is keep cool. So keep frozen, as the name tells, it has to be kept in the freezer component of the refrigerator. Keep cold means it has to be kept in the refrigerator but not in the freezer component. It should be out of the freezer. So where other vegetables are kept, there it is kept. And keep cool means it is kept out of the refrigerator at normal room temperature. And if we go by temperature wise, keep frozen means minus 20 degrees Celsius. Keep cold means 2 to 8 degrees Celsius. And keep cool means 8 to 15 degrees Celsius in America and 8 to 25 degrees Celsius in India, or in simple language at room temperature. So these are the important points which are written on the drug label. Now we will move to the second practical, which is practical of drug advertisement. This is commonly known as promotional drug literature. So basically, when you study, when you go into OPD, you are intern, you are SR, you are sitting in the OPD. MR comes, medical representative come, bring some pamphlets with them, and they give you the pamphlet and tell you that our drug is best out of all the drugs in the market. Please prescribe only this drug. So you need to critically analyze, critically appraisal should be done that what is written correctly in that advertisement, what is wrong in that advertisement. So you should know about that. So what are the information which should be present on drug advertisement? That means promotional drug literature. Obviously, again, name of the drug should be present. Which name should be present? Brand name, generic name, or chemical name. Which name is must? Obviously, again, generic name must be present. But because company is promoting, they will keep their brand name also. So both are usually present. Chemical name is usually not necessary because chemical name may itself be very long. So brand and generic name usually both are written. But what companies try to do, like company can say this is Ecosprin. They write like this, Ecosprin, and then they write aspirin. So they write the brand name very big and generic name very small. Yeah? So there is a rule that the ratio between the brand name and generic name should not be such that we cannot read the generic name. So the ratio kept is less than 3:1. So the font size of generic name may be bigger, but it should not be bigger than 3 times the generic name. Clear? So one is the name. Then what other information should be present on the drug advertisement? Obviously, all the details of the drug. All the details of the drug means for which indications it is given. What are the uses simply? Then by which route it is given. By which route it is given. For how many days we give. Frequency of administration. Duration of treatment. So basically all details about that drug should be present. Then very, very important thing which should be present is cost of the therapy. Important thing to remember is not the drug, cost of the therapy should be written. Like if we want to compare the drug with some existing drug and we found that the existing drug the person will consume 100 rupees, but the new drug the person will consume 300 rupees. So we need to see whether the advantage is so much that present or not. So cost of therapy must be mentioned. But I am stressing again on therapy because suppose a new drug has been formed or that person which has coming, MR is coming with some drug. So he is saying that my drug is costing only 2 rupees per tablet, whereas the existing drug is of 3 rupees per tablet. But when we say that existing drug which is present, it is although of 3 rupees, but it need to be given only once a day, whereas this drug need to be given 3 times a day. So obviously the cost will increase. So we should know the cost of the therapy, not the cost of the drug molecule itself. The next important thing, adverse effects, should it be written or not? Obviously they should be written. So which type of adverse effects are written? Whether serious adverse effects are written or common adverse effects are written. Which should be written on the drug advertisement? Very good. Both should be written. If an adverse effect is serious, even if it is uncommon, they should mention. And if adverse effect is common, whether it is serious or not, it must be mentioned. So all type of adverse effects must be mentioned. Only those which are minor and uncommon, they can be missed. But all common adverse effects and all serious adverse effects must be mentioned. If the company is making some claim, like our proton pump inhibitor is better than all other companies. If the drug is company is making some particular claim, then they should give a reference of that claim. So in which book, in which article, in which study it is mentioned that this is better than the others. Okay? So they should provide the reference. Then we should have address of the manufacturer. So in case any problem occurs, to whom to contact, so that address should be there. Now lastly, expiry date should be present or should not be present on the drug advertisement. Very good. The answer is no. Which expiry we are talking about? We are not giving a drug, we are giving a pamphlet only. Is there expiry of a paper? Obviously not, because the same drug may be formed today, maybe next month, maybe next year. So expiry date will be from the manufacturing of that drug, date on which it is manufactured, then the expiry date comes. So there will be no expiry date on the drug advertisement leaflet. Okay. So these are the important points regarding the practicals of general pharmacology.